Hello, hello.
Hola, hola, hola. ¿Cómo estás?
Muy bien, muy bien. Yeah. Mm-hmm. I was gonna go into my Duolingo library of thoughts, and I was like, no, muy bien. We're gonna stick with that.
I've never asked you if you know Spanish or not. So,
I know a little Spanish. What is it? Yo hablo español muy poquito. Es aprendiendo español. So
bueno,
I'm like,
bueno,
yeah.
bien. Hablamos muy bien. I can talk a little, but not
Okay,
much.
it's just a little bit, just a
That's
tad,
it.
just enough to ask where the bathroom is and also to order food.
Well, we are back and we have a special this is our first time we have a guest.
We have a guest. Yes. And she's answered some questions. Thank God.
So if you guys were watching our last live last week at the end, we were talking a little bit about perimenopause, just a
Wow.
tad. And I think I asked KEISEAN, does she know how long
And
it
Keyshawn did not
takes
know.
before you get into menopause? And I think you said, what, a month?
90 days or a month. I think it was 30 to 90 days, and that is incorrect. And so do not listen to me. I am not a doctor.
Yes. So we have a doctor with us today and a really special doctor, and we're going to bring her on the stage in just a moment. So, those of you who are here, welcome. Say something in the chat for
Yay.
us. We'll be bringing up your questions because tonight is a Q&A. So, this is the
Yeah.
time to be asking your questions.
Yeah, and don't be shy. Don't be shy. We're going to be, as if you can see the topic ticking across the bottom of the screen, you might be asking yourself the same question I was asking myself last week. What is perimenopause? We've heard menopause, we've heard of postmenopause. Is that a thing? Maybe we'll find out tonight. But I know perimenopause is something that I completely had a misunderstanding of until about a week ago. And so I'm looking forward to learning more about it. But yeah, today is June 1st. I hear that it's summertime in the Midwest. Finally.
See how I'm
Yes.
wearing sunny like stuff?
I
Like,
see and I'm wearing a sweater and a cardigan because it's not summertime in Long Beach yet. I don't know. Maybe the weather machine got their geographical locations mixed up.
yeah, I'm not, I'm sorry. I'm just gonna say that. I'm very excited about because I weather the storms all
Yeah.
day in this city. So yeah, it's June 1st. We're not quite summer, but we're about to get in that. And that's really my hot topic because it's getting hot.
It's
It
getting
will,
hot.
yeah,
Yeah. Well, we're waiting for the sun to come out. Today is officially the beginning of Pride Month. So for all the LGBTQIA plus community members, happy Pride, all the allies and everybody who is going to be celebrating for the next 30 days. June is also my birthday month. So today is like
Ah,
27 days until my next relevant birthday, where I will be even deeper into my mid 40s, which is kind of exciting and also a little scary. Yeah, I'm excited to start a new month and really looking forward to being able to converse with our guest. I think the topic of women's health is still something that seems almost kind of taboo, even amongst women. So I hope to encourage those who are watching to drop your questions in the chat or comments, or if anything resonates with you, let us know. If you're learning something for the first time, don't be ashamed. I'm learning with you. Yeah, I'm looking forward to this conversation. I think it's going to be really good.
I think it is too. And this is the guest that we're bringing up, which I'm getting ready to introduce. She's going to be a part of the virtual summit that I've been talking about, which is called the Healthy Vagina Monologues, although it's not really a monologue, but discussions. And we'll be in this summit, we'll be talking about from menopause to perimenopause to pelvic floor dysfunction. And if you're like, pelvic floor, that's a big word. That's just the
That's a
muscles.
big word for Elmo.
It is.
Yeah.
But it impacts so
Yeah.
much, and talk about misunderstood. And so the person who's going to be talking about that, she'll be coming on later in the month. And then we're going to talk about pleasure. Yeah,
That's going to
libido.
be fun.
Yeah, all the good stuff, and she'll be coming on as well later. So this is these Thursdays. Y'all need to stay tuned in.
Mm-hmm.
Turn on your little notification bell. Whether
Yes.
you're followers with KEISEAN or followers of mine, make sure you turn on the bell. If you're not subscribers of us, you should be subscribing to both of our channels so that either way you're
Yeah.
always alerted.
Yeah.
So awesome.
Yes.
Well,
Agreed.
anything
Absolutely. So you
else,
don't miss out.
KEISEAN, before we anything else before we
No,
bring
I
on
think
our
I'm nothing else I can think of. I'm ready to bring her in because nope, let's bring her up. I think it's time. I think it's a good time. If you have any questions, those who are watching, go ahead and drop your questions in the comments. We'll be keeping an eye on those and make sure that we're able to present them to our guests. So again, don't be shy. It's all good. It's a
It's
safe
all good.
space. Even though
I
it's
know,
all over the
yeah.
internet, it's still a safe space. Yeah.
When we talk about this part, and this is why we want to bring in, a professional practitioner who really does this, so that we can have a mature but fun conversation
Yes.
about it while getting informed. So I'm going to bring her to the
Right.
stage now. We want to welcome Dr. Donna.
Hello, hello. Good evening. I'm so happy to be here.
We're so happy to have you. We're so
Mhm.
happy, and I'm so glad you allowed me to stalk you.
You did fine. I
Ah,
need stalking. I need stalking. I don't have a wrangler these days, so stalking is a good thing for now.
yeah, yeah, we met just like KEISEAN and I met. We
Mhm.
all seem to have this very, I don't know, serendipitous meetings on Clubhouse.
Yes.
And that's how I connected. I would go in Dr. Donna's rooms. I would do the rooms with KEISEAN, and I just came to admire both of them so much. So that's when I start the stalking. But for tonight, before we get into our Q&A, and while we bring more people in the space, please share with our audience who your background, what kind
Mhm.
of got you into this space on women's health.
Okay.
Anything you'd like to share? Yeah.
Okay. Well, I'm Dr. Donna G, MD, your gynae guru, and I'm all about menopause. So that's my current iteration. I put in 30 years in clinical medicine as an OBGYN, and that includes my training years. But my last practice was open for 14 and a half years. So I did solo private practice in OBGYN for 14 and a half years as the end of my clinical career. I shut the office down in 2019, sold everything like literally February of 2020. And we know what happened 6 weeks later. I mean, timing is everything. It is everything. And I
Wow.
got to spend a year home alone with my child, which I did not do when he was a newborn. And I tell everybody I got my do over. And I'm forever, ever grateful. I mean, the pandemic was terrible in a lot of ways, but it is an area of gratitude for me. And then we got sick of each other because, we had a year together at home alone. And it's time to get back into life. And I started feeling as though I needed to do something constructive with my time. As I used to tell him when he was a kid, you tell parents, don't tell your kid no, or they'll be telling you no all the time. So I start telling him, do something constructive with your time. Find something constructive to do with your time. So I needed something constructive. And I have this expertise and I have this experience and I want to share it because I was always surprised by the number of women who came in knowing nothing about menopause, knowing nothing. And I knew nothing about a digital business, but I know a lot about menopause. And I've taken care of thousands of women in my career. And in my last 10 years, I really kept a special place in my office to focus on menopause. So I did bioidentical hormones, but I also did herbal. I I was known to meet you where you're at. So you come in and I get to find out what is it that you need my help with.
Mm.
Because it's a very individual decision. I had plenty of patients that came in wanting nothing to do with hormones. So I didn't even go there. And that was fine. I had plenty of folks who were just like, I need that pill today.
Mm.
And they left with a shot of hormones. They were going to feel better. Like, you got 36 hours, you're going to feel better. And, you'll be feeling better by the time your prescription's ready. And I had folks who wanted nothing, who wanted no intervention and whatnot. And I always told them, you don't get points for suffering, you
No,
know?
no. Yeah.
And then I've actually had a few women in their 60s. They were like, oh, well, I just want you to check my hormones. I was like, why? Oh, well, I just wanted to make sure I went through menopause. I said, how old are you? Oh, 64. I said, when's the last time you had a period? I haven't had a period since I was like 50. I was like, you went through menopause. You don't need hormones. It's really, it
Wow.
involves, oh, please, but it's an individual experience.
Yeah,
Mm.
I can see
For,
that.
for every woman on the earth, that's the kind of experience menopause is.
Wow. Well,
You
you
know?
just you just said, I think just alone what you just said is going to spawn a whole bunch of fun questions, especially with that last statement that you said with the 60-some-year-old. So,
Yeah.
That
yeah.
said like, oh, do I need hormones? Yeah, no, you touched on a lot of things, and I see there's already a question in the comments. So let's start with Daria's question. This is my mom, Dr. Donna,
I
and her question is, what is considered early for menopause, or like, is there actually such a thing as early menopause? Could you
yes,
could you give us some insight on that?
yes. Before 40.
Now, does that depend on when a
No,
woman starts menstruating, or any just before 40
before
period?
40.
Okay, it's
Before 40.
considered early. Okay.
Normal age range is 45 to 55.
45 to 55. Okay.
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 And so if we take that a little bit further, and technically you start talking about standard deviations and what's the average curve and that kind of thing. And
Hmm.
so then you go to 40 to 60,
Okay.
and younger than, if you finished your cycles before 40, that's early menopause.
Mm.
And if you're still having cycles after 60, that's very late. Now, I always tell people, and it's funny, there's going to be a podcast episode about this, not in terms of not trying to live up to a label. I,
Mm.
I think that is one of the things that puts the physicians and patients in kind of in different worlds, not quite on the same page, because I always was amused. And I'll be honest, I used to laugh in the office all the time. Oh, I think I'm early perimenopause. I was like, oh my God. I was like, stay off the internet. I'm like, what are you talking about? I'm like, come on now, what are you talking about? We get so concerned that we don't understand what stage we're in and things like that. And one of the things I talked about a lot on the clubhouse room, we don't talk about what stages people were in puberty. We don't get obsessed with, are they pre-puberty? Are they in the middle of puberty? Did they finish puberty? None of us can say when puberty finished.
Mm.
You know,
Good
we
point.
can't really say when it started,
Right.
Right.
but you know when you're in the middle of it. For
In
the
the
most,
middle of it.
you're in the middle of it,
Yeah. Can you
and it may not
explain?
be bad.
Oh, I'm sorry, Dr. D. Dr.
Go
Donna,
ahead.
can you mentioned this, and I just want to, for clarification, because this was
Yeah.
a new piece of terminology that I learned just a week ago. But can you explain some of the key differences between perimenopause and menopause, and kind of what to expect in those stages?
Physicians don't really use anything other than menopause. Okay, and so one of the things, let me kind of give you the lay of the land. When we are talking about physicians, we are talking about the people that are there to deal with significant life-threatening problems and whatnot and who not. And menopause is a normal transition period. I think that gets blurred so many times, and so patients a lot of times are going in because they want education and reassurance. And your doctor's like, you scheduled for annual exam and I got 10 minutes and then I've got it. And
Mm.
there's a disconnect. And so that's really kind of the slot I'm trying to fit in when it comes to what I'm doing now, so that you're educated, that you're informed, that you feel comfortable knowing what's going on. So when we talk about perimenopause, by definition, perimenopause is around menopause, is that time frame that encompasses menopause. So menopause is the name of this transition period. And we say you have completed menopause when you have gone 12 continuous months without any bleeding or any cycle in the right age group.
Mm.
Okay?
In the right age group. I'm
In
glad
the
you're
right age
mentioning
group.
that. Okay, and that's the 40 and above, essentially, or 45 to 60,
45 to 55.
65. Okay, okay.
But the majority of time, the patients between 40 and 45 or 55 and 60,
Mm-hmm.
it's going to be normal menopause when they're having issues with their cycle. Their
Mm.
cycles or their cycles disappeared or whatnot.
Mm-hmm.
Typically, it's still going to be menopause. It's just
Okay.
that the overwhelming majority of women will achieve menopause
Mm-hmm.
in that age range.
I like how you say achieve.
Yeah.
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 You've
I was,
arrived.
Yes.
yeah.
Go from one state to the next. Go from a high hormone, cyclical hormone state that supports fertility to a low steady state hormone. That's the transition. All the symptoms are withdrawal. I mean,
That's interesting.
all
No,
the symptoms are withdrawal.
I'm so glad you're putting it in this language so people can
Yeah.
understand that, it's because the hormones are dropping off and there's a withdrawal of things, and that's what's
Yeah.
causing. It's not,
Yeah.
oh, menopause is this bad. It's natural. You achieve it.
And it
I,
can, and it can be terrible. I tell people, Kenya, all the time, I'm not into fairy dust and gloom and doom and that kind of stuff. I'm very real. I
yeah.
want your experience to match the expectations that I put out there for you. And a lot of my patients always told me that it was exactly like you said it was going to be. And that's important to me. I want you to be prepared, but don't try to own anything because you don't know what your menopause is going to be.
Well, brings me to kind of a follow-up question to Daria's question about, what's considered early, and you breaking down those timelines is really good and important. And she put something else. It wasn't a question, but a comment. And I've questioned people who have hysterectomy, so they're not having periods anymore. So let's say you kept your ovaries, but otherwise you don't have the hysterectomy, so you're not having periods. How will they know when they've achieved menopause? Or is that something that really the doctor has to come in and diagnose? Or
I mean, it becomes again a matter of symptomatology.
Yeah.
And kind of where you're at. And so it's a very individual thing. So I did see, because I have the comments open. So
Mhm.
what I'm talking about is spontaneous natural menopause, when the ovaries run out of eggs. If your ovaries are taken out before menopause, then that's not spontaneous, and the symptoms are going to be far more severe. And I mean, when I did hysterectomies on patients and I took their ovaries out, I had them put a hormone patch on in recovery room.
Mm.
Why even go through all that? I had occasional patients, and I say very occasionally, that, oh, I'm going to be fine and whatnot. I said, okay, but don't call me in the middle of the night. I said, don't you call me in the middle, don't you wake me up, because I'm trying to tell you now, this is not going to be a fun ride. I'm telling you. And I've only had one that did not take hormones after surgery, and she gutted it out. And I was like, okay. And none of them woke me up. But so it's a different discussion when you talk about ovaries taken out at surgery, ovaries that were damaged because of chemotherapy, things like that. That's a different discussion. That is not normal physiologic menopause. Okay, so that is very much in line with addressing what's going on. What happens when hormones are gone before the age of 40? What are the ramifications
Mm,
for that? Why is there much more of a push to be on hormones in patients who don't have a cancer history, that type of thing, or cancer risk?
right, right.
The
What are
smart,
some of the
go ahead. I'm sorry, Keisha.
It's okay. What when you say like don't call me in the middle of the night, what are some of the symptoms that perimenopause or menopause might bring? I've seen the TV shows and movies and women putting their head in the refrigerator to try to cool off and the hot flashes and the cold sweats and all the things. Can you share kind of what of those symptoms are like actual symptoms versus the ones that we kind of see in media that might not be quite accurate as to what typically women will experience?
I don't think I've seen it as much as the media is sensationalizing things. All that's within realm of possible. All of it. There's almost. I mean, I've had patients with palpitations.
Mm.
You name it. And I go back to it's withdrawal from high hormones, and everybody's going to react differently. So the classic hot flashes, night sweats, flushing kind of thing, that's one set. Dryness everywhere, eyes dry, hair dry, skin dry, vagina dry, dryness. Um, we see increased complaints of leakage of urine. Um, I've had patients with dry mouth, and that was,
Mm.
I mean, I've had three patients literally in the last year and a half that I was in practice that came with significant dry mouth, and that those three were the first three I'd ever taken care of in my entire career. I had to go look it up, but it's real. It's difficult to treat, and two of the three got good relief, and one didn't.
Mm.
And it wasn't even hormonal things that helped them. Um, Mood changes, and so that's all over the place. I probably would tell you that anxiety, edginess. And see the thing about menopausal symptoms, if I never told you what to expect, quote unquote, for menopausal symptoms, women come in and describe exactly what's happening. I used to refuse to tell patients, oh, okay, I'm not going to tell you because I don't want to put it in your head
Mm.
what to expect. Because you will come in, you may not know that a hot flash exists, but you can come in and tell you, I keep getting hot and I do not know what's happening. I burst into a sweat. I do not know what's happening. Or I'm waking up in the middle of the night and I'm drenched in sweat and something's got to be wrong with me. You could know nothing about menopause and you're going to walk in and say the same thing.
Mm.
And
Yeah.
so there's a consistency there. Certainly changes in your cycle, but one woman may have cycles that skip. Somebody else may have cycles that are getting further and further apart. Some women will have cycles that are getting closer together. My cycles actually got closer together. I went from every 35 weeks to every 28 weeks on the nose. My my last 5 years, every 28 days. I'm like, what the hell? I want my week back because I used to be every 35 days.
Thank you for that. We have another question. This is actually another relative. This is my cousin Keith Matthew. And thank you. This is a gentleman who's tuning
Yes.
in. He's asking, what can men do as far as support during these changes for their loved ones and their family members? That's a great question.
A
Thanks for
great.
asking that.
That's a perfect question. And I am actually going to do a workshop for men later in the
Ah.
year. Yes, because I get that question all the time. Plenty of patients came to me because their husband sent them in. So, what has worked the most? Being patient, realizing it's not about you.
Yeah.
And so you got to give space for her to transition into the next phase. And when you start talking about relationships, one of the things I will tell you, and right in that menopause, that 50-year age group, that's not so critical. But as time goes on, relationships evolve and the sexual side evolves as well. And that's one of the things that my long-standing couples always talked about. You evolve a lot of the things. Now, we start talking about vaginal dryness issues, libido issues, those can be addressed. But the level of communication and the level of intimacy can change. And a lot of that has to do with the fact that you're changing. Men are changing too. But men just have a slow decrease in hormones their entire lives.
Mm.
And women are trucking along until the ovaries run out of eggs, and then it's a much shorter transition time. But midlife is midlife, and so this is the time to communicate. One of um, one of the people I might interview on my podcast, if I can catch up with her, another clubhouse person, she talked about how she and her husband, she just didn't want sex, and she just was not dealing with it. But he was in it to win it, and it took longer to get aroused, and half the time he had to go look for her and find her. That was the running joke in my office, that when you start talking about libido,
Yeah.
you don't care about anything. I mean, it's, you don't want to do anything, and you don't want to be bothered. That's what most of the women would say. I just don't want to be bothered. I just didn't think about it. But that's global. That's not just you. And so
Mm.
husbands take that very personally. Oh, she doesn't love me anymore. No, it's not about you. It's about that I don't care. I'm not, leave me alone. And so I would always ask seriously. So I would ask my patients who would come in, because they would be so nonchalant. Most of them would be nonchalant. A couple would be upset because they were just like, I can't believe I don't really care about sex anymore. I was like, yeah, that's temporary. Don't worry about it. But most of them would be just
It's
laughing.
temporary. Okay.
Well, yeah.
It is. It is. Now, there are layers to the notion of temporary, because a lot of times
Of
it's,
course.
what's the status of your relationship?
Right.
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 If
Right.
you're a husband that demanded sex whenever you wanted it, regardless of whether she wanted it,
Mm-hmm.
if you're a demanding partner,
Mm-hmm.
menopause is not going to go well.
Mm.
Because
Heard.
I've had patients come in and we're going over menopausal symptoms, and they talk about libido, and I used to just want to run and give them hormones, and one lady was like, "No, I'm good." I'm like, "Oh, oh." She said, "He's had enough." I was like, "Oh." And
Yeah.
so menopause is kind of that time of reckoning,
Mm.
and if there's some scores to settle, especially sexually, men, you're gonna find that out in menopause, in that transition.
Mm. Mm.
I'm so
Mm.
glad you're bringing this up, because that was going to be kind of one of my questions, is about lifestyle. And I think that kind of goes into the lifestyle space, but you just were, suggesting about the relationship. But
Mm-hmm.
I guess, what are some lifestyle considerations that women can make, um, that outside of maybe a medical treatment, but some more lifestyle things that they could do to manage symptoms, or, you
I think
know,
you're sugarcoating it. Spit it out, Kenny. What are you asking me?
like in terms of diet, nutrition, movement, are there more holistic things that women could be doing, as well as mental health things?
But all of the, yes, and
Hmm.
yes and yes and yes. But all of those things come together, and it becomes, what's your outlook, you as an individual? What's your outlook on all of this? Do you want a quick fix that I can almost guarantee will work? Well, then that'll be one thing, and that'll take me down the hormone side, because they're powerful, and I know they're going to work, and I know they're going to work fast.
Mm.
Are you somebody that wants to do completely holistic, organic, this and that and the other, whatnot? Okay. Whatever oil is in your kitchen. Lubrication is lubrication. And oil is the best lubrication. All this KY and stuff like that is water based. And those only came around because of the HIV epidemic. And we insisted that the only protection at that point were latex condoms, because regular lambskin condoms did not protect against HIV. And so you had to use latex condoms. And so the industry to promote that kicked in, and oil will break down latex. Prior to the HIV, all traditional society, all, I say traditional, all societies, communities, whatnot, understood you use oil. Grandma and grandpa use bacon grease. You
I
know,
was going to ask Dr. Donna, now, when you say oil in your kitchen, you mean
what
any oil?
food grade oil,
Food
any
grade oil.
oil.
So if you can eat it,
If you
ingest
can
it,
eat
then
it,
you
you can
can
eat it.
there you
There
go.
you
There it
go.
is. Okay.
Yeah, you can eat
Okay.
it, you can eat it.
Heard.
So, food grade
Okay.
oil,
Food grade. All
food
right.
grade oil. And so that means not mineral oil, not baby oil, because baby oil is
Right,
basically mineral oil.
right,
Okay?
right.
So, you want a tropical fruit salad or you want a regular salad. You want olive oil, you want coconut oil. I mean, any food grade oil.
I
These are
love it.
good.
You want a
I
you
don't
want a
know if I.
Greek salad? You want a fruit salad? What kind of salad you
Yeah,
want tonight?
you know.
No,
And that's
heard
specifically lubrication.
for
Now,
sure.
when we start talking about um, more extensive vaginal dryness or whatnot,
Mm-hmm.
you know, I would say most women didn't come in with an ongoing kind of daily sense of vaginal dryness, but discharge decreases and things like that. So for women
Mm-hmm.
who had normal discharges, they are more likely to say, well, I just feel dry. And so when we talk about basic moisturizing kind of things like vitamin E and hyaluronic acid, that's, you know, if you got it, you could put it on your face, you could put it on your vagina. Now, that's not to say that you don't put retin-A, the retinol oils and stuff like that, but a basic moisturizer, none sunscreen, none of that.
Yeah,
A
yeah.
basic moisturizer with some hyaluronic acid, maybe some vitamin E. All that's available over the counter.
That's hopeful. Well, like kind of to follow up on your question, Kenya, one of the things that you mentioned, Dr. Donna, that like I guess one of the potential symptoms or things that women can experience in addition to vaginal dryness, maybe change in libido, sleep changes, and things like that, is something to do with the bladder. I heard. Can you talk a little bit more about what ways that we can potentially approach that holistically? Because I know, speaking for myself, I'm gonna just put all my business out there. I will be 46 at the end of this month. And about roughly 2 years ago was when I started to notice just some changes in my cycle frequency, changes in vaginal lubrication cooperation, and also notice that my bladder feels like it's 80 years old right now. And so, can you talk a little bit about that particular component and maybe what women can potentially do to address that?
But yeah, I mean, the lower bladder is estrogen sensitive, just like the majority of tissues. So when you have less estrogen, you have, I'm not going to say less responsiveness, but the tissue has to adjust to now not being showered with high levels of estrogen. And that's why we start to see symptomatology. So the muscle tone and the thickness and lubrication and really blood flow into the tissues can all decrease. Most of us have damage in the lower bladder. The floor of the bladder is the roof of the vagina. And so pregnancy and childbirth have already damaged to some degree all of that tissue. Estrogen kind of the lack thereof really kind of uncovers some of that damage.
Mm,
And so we see what the damage in the pelvic floor has been. A lot of times, increasing the muscular strength in the pelvic floor can be helpful.
yes.
Maintaining hydration, but let's be honest, we are notorious for holding our urine. And so being in a position where we are regularly emptying our bladder and not over distending our bladders consistently can be helpful. When you start talking about teachers and nurses and doctors and whatnot, it's a whole different ballgame. I mean, the amount of urine that can be held is quite impressive. And so over time, that stretchability, that's what we call elasticity, that stretchability is also lost when estrogens are lost. And so if you've got an overstretched bladder, its ability to kind of come back down to something more reasonable is likewise impaired. So you've got to be training with your bladder in terms of not holding large amounts. You need to work on the pelvic floor in terms of strengthening the muscles because you can't do anything about the tears in the fascia. But if we strengthen the muscles, then we have better control. And we talk about, well, look, we always said don't give away too much, but repeating things is not a problem.
I was going to say, it's good. Go ahead.
Yeah,
Because
lunges and squats are your friend. We talk about Kegels. Most people don't even do Kegels right. Lunges and squats are your friend.
Lunges and squats. Okay.
Yeah. Lunges and squats are your friend.
Got it.
It's going to improve the pelvic floor musculature.
Okay.
And to your point, KEISEAN, that's why I'm bringing in the pelvic floor physical therapist, because I am currently doing pelvic floor training and bladder retraining because I have the complete opposite effect.
Okay. No exit. Yeah.
We're just going to go, okay, time to pee.
That's it. That's all you get. Okay.
It's been trained kind of in the opposite way because of such a weak pelvic floor.
Okay.
So I have learned a lot about that. That's fascinating.
Good to know. Yeah, thank you for that. That's really helpful. Lunges and squats, and I'm glad you mentioned hydration as well, because what I was noticing is I was deliberately under hydrating, especially when I knew I was going to be away from home for a couple of hours, just because I didn't want to have to. I'm like, let me empty everything out before I go outside, and I like to go for walks in the morning, and I'll get 3 miles in, and I'm like, I gotta go. So that's helpful. I will be working on those things in the meantime.
Okay.
Thank you.
Yeah, yes. Thank you for introducing that topic because it's a really common situation, KEISEAN, super common. And, the pelvic floor physical therapist, what you just said, there's a whole trick about this emptying bladder, but it's called the just in case peeing. And I have been training on stop the just in case peeing. I know, scary, but we'll get into that. I have a question for you, Dr. This question now, this might be more political. This might be more social activism than biology. But what are you seeing? Is there anything that you're seeing different? Because this is Black Her Story. And here, our audience, we're really encouraging, helping Black women to understand themselves, hear other Black women's stories. But do you see any difference between Black women and non-Black women and their menopausal symptoms, ages, or anything that we've talked about? Is that any cultural and determinants or factors?
No. Now, are there ethnic differences in how often we see certain things versus other things? Yes, but if we get too much into that, and I'm not discouraging that because I love this, but if we get too much into it, then we start having this notion that, oh, that only happens to white women. Oh, that only happens to Black women. Fibroids don't only happen to Black women. 50% of white women have fibroids by the time they hit menopause. Now, 75% of Black women have fibroids. So there's a difference there. But the notion of always talking about fibroids with Black women makes other women believe that they don't have fibroids. And they're shocked when they see they have fibroids. Well, fibroids all over the place. Everybody's got fibroids. 50% of American women across the board have fibroids by the time they hit 50. Osteoporosis. I had a patient that I could not, she was in her 40s and already had osteoporosis and had a stress fracture in one of her vertebrae, a Black woman. And she changed doctors because she was offended that I was insisting that she had osteoporosis, because in her mind, only white women get osteoporosis. No. Women who have osteoporosis have osteoporosis. Now, are white women more likely to have osteoporosis, get it earlier, have it more severe? Sure. And so they will have a lot more baseline familial information about that, just like Black women will have a lot more baseline familial information about fibroids, because so many Black women have fibroids. We hear about it all the time, but you don't hear about osteoporosis. Same thing with white women. They hear about bone loss all the time. They can point to all their little grannies that are hunched over and or fractures and whatnot, but it doesn't mean it doesn't exist in the black community, and it doesn't mean fibroids don't exist in the white
Mm,
community. Um, we talk about breast cancer, and we get those messages confused. Breast cancer is far more common in white women, but black women are more likely to die from it. And we talk, and when we start breaking down genetics, come on now. The notion of ethnicity is social and political. When we start breaking things down on a genetic level, then a lot of that starts to come into question because in the US, one drop of black makes you black. And so you can be 75% white genes, European genes, but come through a black family and consider yourself black, and that's fine. But then that's why we don't get caught up into rigidness about whether a disease is showing up in somebody black versus somebody white. Does that make sense?
yeah,
Is that
absolutely.
fair?
Yeah, no, I think it's fair. I think and I'm glad that you're kind of showing this, when we pull the dialogue in one space, it starts making us think maybe this is the only and not always understanding both sides of
Right,
this coin.
right.
And so I
Because we
just,
can't not talk about osteoporosis.
yeah,
We
right. And
can't
I,
not talk about vaginal prolapse, pelvic
yeah,
floor disorders. We see them less in black women, but that doesn't mean they don't exist. That does not mean that there are not black women where their uterus is in their vagina, is in their panty. And yet, I've had 20 something year old white women where that has happened. And they were stereotypically high risk and whatnot. And so when you see thousands of women over the years, you're going to see all of these things. And so I did not fail to talk about fibroids with white women and talk about prolapse with Asian women and talk about fibroids with Mexican women. And, I just didn't fail those things because these things happen to women, and knowing the broad range of what can happen and what we need to think about makes a big deal. It makes a big difference. When we talk about hormones, even when we talk about birth control, I'm going to keep in mind the risk of fibroids. Is it going to be good or bad, one way or the other? And yet, pregnancy has so many other risks, it tends to outweigh the
mm,
other concerns. But we pay attention to those things.
mm,
If I know someone has a strong family history of osteoporosis, I'm much less likely to have a low estrogen pill than a high estrogen pill because I want them to get that estrogen exposure. I very quickly became unwilling to give teenagers hormone contraception that suppressed their cycles that did not have estrogen because women don't make their maximum bone density until about mid 20s, early 30s.
mm,
And if we are shortchanging high dose estrogen in our teenagers and young women, then we are increasing the likelihood of osteoporosis at an earlier age because they never achieved their maximum bone density. And once we get to menopause, the maximum loss of bone happens in the first 5 years after menopause. So wherever you start, you're going to plunge. And if
mm,
we've shortchanged where you can start, okay, so if you're supposed to be starting here, but I've got you starting here, let me come back here. If you're supposed to be starting here, but because of choices we've made with teenagers and non estrogen containing birth control pill, they're actually starting here, you're still going to lose the same amount. Okay, but
mm.
you're starting behind the eight ball. So there are a lot of nuances in terms of what we're doing in terms of care
Right.
over the lifespan of our fertility years.
Yeah. And there's so much that we're just not even, I mean, this whole conversation that you're giving These are not spaces that, I mean, you have to kind of get them in drips, you know, learn a little bit over here, learn a little bit over here. So, yeah.
And it's kind of like, because something you mentioned earlier in the conversation is typically when women are having the opportunity to sit down with their practitioner, with their OBGYN, with their doctor, it's an appointment that they might have taken weeks to be able to schedule. They show up for the appointment. They spend more time in the waiting room than they do in the exam room. They have their exam or they have their checkup, and there might be 5 to 10 minutes for them to ask some questions. And if they don't come in with questions ready or come in feeling confident enough to talk about whatever symptoms they're having, all of this information gets missed, and then they go to WebMD and they're self-diagnosing and they're trying supplements that they shouldn't be trying, and they're putting yoni eggs in their vagina that may or may not be helping them, or they kind of end up in all these different crazy directions because they just don't have the knowledge. So this is so valuable. I'm just, as I'm, wow, didn't know that. So I just appreciate you for being so open and so transparent with your wisdom, because it's very, very helpful. It's very helpful, and it's very necessary. Yeah.
Well, thank you. Thank you.
Absolutely.
And I'm glad, because you're not going to have a coffee table discussion with your gynecologist ever unless they're set up that way. And private practice needs to change for a lot of different reasons, not the least of which is to be in a position to be able to have these kind of discussions and get paid for it. To be totally honest, because it's about that level of expertise. But if I'm spending an hour, I need to know that that's an hour to spend so that other people aren't sitting in the waiting room when I have you scheduled for 15 minutes for a well woman visit and there's a list of problems. Does that make sense? So a lot of what I do is also educate consumers. If you are there for your well woman visit, that means that you don't have any problems. So you need to schedule a problem visit. There's no such thing as an annual exam anymore. There is no such thing as an annual exam anymore.
Okay, wait a minute. Hold on. Pen in this. Explain that. What do you mean there's no such thing as an annual exam?
It used to be you go to the gynecologist once a year, get your pap, and take care of all your issues. That doesn't exist anymore. You're getting your pap smear and your refill on your contraceptions or your hormone replacement therapy or whatever. That's a well woman visit. By definition, we are there to make sure everything looks well, feels well, whatever, refill, and then we move on to the next thing. Get your lab work done. That's primary care stuff. Does that make sense? But if you have a question about menopause, that's a problem. That's a problem. If you have a question about my cycles are twice as heavy as they used to be, that's a problem. And seriously, go back and go look at your last bill from the insurance company on your pap smear. It says well woman visit. That's what you're getting scheduled for. If you need to talk, you schedule an appointment for a problem visit. And it could be menopause. I'm having hot flashes. But you schedule an appointment. And the key, the thing is, the key is that you need to know if you've got a doctor that's going to even want to talk about it. See, that's what a mismatch is.
Yeah, that I was just going to say that.
Oh yeah, it's a huge mismatch. Yeah. I'm not the approach that I have did not come from my training. It came from my experience in practice. Because what I'm trained in are the problem sides. But menopause is a normal transition period. That's why so many gynecologists, especially guys, blow people off. When you're just like, oh, I'm having hot flashes or whatnot, they're like, okay, well, it'll get better. But if you don't go in, like KEISEAN said, very, very appropriately, go in with your list of questions, go in with your expectations of what you need to have addressed. Don't leave it to me as your physician to tell you what's wrong, because menopause is not wrong. Menopause is normal.
It's a normal thing. Yeah.
There are women that don't care about the hot flashes.
Well, I was going to say there's probably women who just recognize this is just like when we start menstruating, it's like this is normal. This is a normal part of life. We take whatever, precautions
Yeah.
and whatever protections. But I think that because menopause happens, well, I guess the beginning kind of happens unexpectedly too. Like you said at the
You're,
beginning, it kind of just happens. And I think that
Michelle, you're in
sometimes
the perimenopause yourself right now.
I know, girl, I know.
You
That's why I got all these questions.
and so you have to know the part that's the problem that
Okay.
you need fixing. Does
Okay.
that make sense?
Yes, it does.
I tell folks when I was in the throes of it, I didn't have hot flashes. I was just hot.
Just
And when I
all
tell
the
you
time.
hot,
Yeah. Huh?
24/7 for about 2.5 years, I was hot. And I live in Central Florida.
Yeah, I was gonna say, but that would be hard because you're in hot Florida.
Yeah, I didn't stand outside and talk to people. Do not try to talk to me outside.
Yeah, my partner probably it's about 68 degrees in our apartment year round for the
Yeah,
last 2 years because
yeah.
it's just like constant hot, constant
I
hot.
turned my thermostat down to 68. I turned the
Hey,
thermostat in the office down to 68. I bought a space heater for every exam room and every workstation. My employee and I bought sweaters for my employees
there you go. See, that's
because
what I'm talking
you don't have
about.
to
That's
suffer
very
with
thoughtful
me,
of you,
but
because
you
Very
don't want me to
thoughtful.
suffer
Right.
yeah.
Hey, no, not the doctor, that's for sure. We have
because
I
the
think there's
heat.
another
Let
oh,
me
go
finish.
ahead. Sorry, doctor. I
Yeah,
think there's
I was
two
gonna say the heat
more
didn't bother
questions.
me
Go ahead.
as long as I could control
Okay.
the thermostat, but the moods. That's
Mm-hmm.
when I had to get intervention because the moods were so unpredictable
Yeah.
and so not me, and I couldn't control it, and I couldn't even predict it.
Yeah.
And I got into a screaming match
Mm,
with a patient's husband, and that's how you get sued. People sue you because they're mad at you. They don't sue you because
Yeah.
you make a mistake or not.
Right.
You can do
Right.
that's
everything
true.
right, and if they're mad at you, they're going to sue you. And
That's
I'm
Absolutely.
true.
screaming back at this guy,
Yeah.
and he said something bonehead, but husbands say bonehead things all the time.
This is a
So
very
it's
good
nothing
point.
new. Yeah.
Yeah.
But
Yeah.
me reacting to it at his level,
Mm.
and I could tell I was out of control, but I couldn't stop myself. I was
She's like,
gasped.
oh, it's like
He
Dr.
literally
Pepper on Mr.
gasped.
Hyde. It just kind of settles in. There
Yeah.
Yeah.
was my mom has a lot of questions. So let me
Go
see.
for it, mom.
Let's look at maybe the second question, which is what are your thoughts on no annual PAPs after 45 and then no more after 65?
Do you feel like you understand where? Okay, so the answer would be no. You don't understand. That's why you're asking me. Um, the point of a Pap smear is to find changes consistent with progression towards cervical cancer. That's the point of a Pap smear. Okay. The median age or the average age for which women present with cervical cancer is in the 40s. So prior to Pap smears, women died in their 40s from cervical cancer. So the risk decreases after a certain age to have new changes with your Pap smear. Now, a lot of that initial information came from a time where women didn't have multiple partners. We think HPV has always been the factor. We just started learning about HPV. HPV wasn't as widespread because women didn't tend to have multiple partners over their lifetime.
Mm.
Okay. And so we don't, when you are in a mutually monogamous relationship with no previous abnormal pap smear, and you've gone 3 years with normal pap smears and a negative HPV, your risk of having cervical cancer type changes, even precancer, dysplasia, in the next 3 years to 5 years is low. That's the key. And so you see changes because we have better information about what to look for. Pretty soon, right now, there's actually controversy over having a pap smear and pelvic exam now that we can test for HPV with either a simple vaginal swab or urine sample.
Yeah.
Once we can test for HPV non invasively, what does that mean? To be honest, what does that mean for gynecologists? And so a lot of gynecologists are up and oh, we're going to go out of business. Like, so what? Dentists didn't go out of business. They almost went out of business with fluoride and taking care of cavities, but people's teeth are still jacked up. You change and you evolve. Again, when we start looking at the risks over 60, you look at that same risk benefit analysis. What's the risk that we're going to miss a cervical cancer in a patient over 60? What they don't talk about is the fine print. It's got everything to do with whether you are exposed to HPV or not. That's the fine print. That's the reality of it. You are 18 and you have a new sexual partner every year. You don't need to be skipping PAP. I'm sorry, every month. You don't need to be skipping PAP. Hell, every week. Do not be skipping PAP because your risk of HPV is significant.
Interesting.
There's vaccination now. And guess what? For women who married their high school sweethearts and only had one sexual partner and then they're divorced at 40, they need to get the HPV vaccine. Divorced at 50, they need to get that HPV vaccine because they are likely not having been exposed. And you're going to get out here in the dating scene and let me tell you, everybody's got HPV. There's no romance.
Look at KEISEAN's face.
Well, there it is. Everybody's got it.
There it is. Oh, Dr. Donna, you are like, we are getting close to our end time, but this is so awesome because, y'all, this is why we want you to come to the summit.
Yes.
Because you'll have more time. She's going to be doing a more formal presentation so that she can really kind of dig into even more of these. Daria asked beautiful questions, really thoughtful. Your cousin, Keith, the male side of things, I think is so important. And we could really go in. I know I'm in a space trying to help my partner better understand, all these changes, going on, with me. So this has been really awesome. KEISEAN, we're gonna, and y'all know the Nuggets are playing Miami Heat and she's in Miami and we got all kinds of things. We want to be respectful of Dr. Donna's time, but KEISEAN, any last minute questions?
Don't mind me, just Wi-Fi doing. My Wi-Fi is going through menopause.
Yeah.
The Wi-Fi hormones are depleting. But no, I appreciate you so much for answering my questions and addressing the questions that came in the chat. Just you are truly like a wealth of knowledge. So thank you so much for just giving freely of your time. I really, really appreciate it.
Welcome. You're very welcome. My pleasure. Not pleasure. Because this is the level of information that people need, that women want.
Yes.
This is what you're going to the doctors for and getting rebuffed. And don't get me wrong, my colleagues love that I'm doing this too. They're like, please educate folks so they don't start coming in with these Google searches. And oh my God, Chat GPT. I put some things in Chat GPT and Chat GPT will tell you anything.
Well, that's a whole thing too, because it's pulling, I think for the medical field, it's going to be very interesting because all AI is pulling whatever is out here. So that's a mix of truth and not. So it's, given a lot of stuff. Well, again, thank you so much. I'm going to put, I want people to know if you want to be able to come to the summit so that you can hear more from Dr. Donna. Also, during the summit, we'll be able to talk a little bit more about how you can actually get some of her services and all of those things. So we want you to make sure you come. So, that's KEISEAN's thing. That was the wrong link I put, but we do want to know about KEISEAN too. That's her spiral. But this is the place. This is where you're going to go to register. OneDaySummit.eventbrite.com. We have a discount code for you guys for watching and listening and being a part of this. So be sure. This is going to be on June 24th. And Dr. Donna is going to be our first presenter. So you want to get there nice and early. It starts at 10 a.m. Central, 11 a.m. Eastern, and 8 a.m. Pacific. My California crew is a little bit early, but but we definitely want people to register, because this is why I brought her, because just a wealth and just very also, Dr. Donna, what I really appreciate about you is being so relatable and, just breaking things down in ways that make sense. We can understand it. I think that's another complication. I think a lot of women are suffering in silence. Yeah. And not even in normalizing things that they should not be normalizing. So not knowing that, should I be asking more questions about this? Or should I, I've just always, had this go on with me. And so I really want to encourage people to, while this may be a sensitive topic, because we don't have many spaces where we talk about our reproductive health like this, I encourage people to come so that you can learn more. So awesome. Well, ladies, I think we're going to wrap up. KEISEAN, any announcements for anything coming up for you? That you have your summit, I believe, this weekend.
I'm a guest. I mean, I'm a guest speaker at a summit, and it's one of my clients. So I do coaching and things like that. And one of my clients, Dawn Rivers, is hosting a Business of Wellness Summit, and it's June 8th through 11th. It's completely free. It's all online. There's over 20 different speakers, and I'm one of them. And it's a conference specifically for women of color who are either wellness entrepreneurs or aspire to be a wellness entrepreneur. And we're going to be talking about how to become profitable and scalable wellness business owners. So it's really exciting. You can register for it. If you follow me on Instagram, you can find me at KEISEAN Rains, and there's a link in my bio for you to register.
Excellent.
I love it. And Dr. Donna, is there anything, last minute things you want to tell the audience before we shut things down? Something that we didn't ask, but you're like, or just anything that you want to give?
Oh, you know me, I'm excited about my podcast being out.
Talk about it. How can we listen? Yes, what's the name of it? How can people tune in?
One of the things that I did that really kind of resonated with my spirit is getting my podcast together, and really it's exploring menopause and midlife and this whole transition, because we talk so much about menopause and are so afraid, but you know what? This is a great space to be in. So my podcast is called A Whole Grown Woman. Can I put something in the comments? I'm gonna put it in the private chat.
I'm gonna put this down. You said it's a Whole Grown Woman podcast.
Yes, it's a Whole Grown Woman, and I am putting the link into the chat so you can put it up. And I love it. And we just talk about things. So the episodes come out on Tuesday. My third episode came out this week, and the fourth one is ready to go. I'm going to do a special one on Juneteenth, but I'm just dropping something every week, and just talk about a little tidbit here, a little tidbit there when it comes to menopause and midlife and all these changes and all the things that happen, and the good, the bad, the ugly, the funny, some of all of that. And it's only about 15 minutes, because you know what? Y'all don't have time to listen to all me drone on, and I don't want to drone on. I've got other things to do. So A Whole Grown Woman podcast, I would love for you guys to subscribe. If you go to the link on exposure, that's where I have it. There's some visuals there. It's not a video cast yet. What it'll end up being, when I get ready to do a video cast, it will be a TV show. But for now, it's a podcast. And I think you'll love it. I'm loving doing it. And that's my entry. And then I've got a book coming up later. So we'll do a special for the summit to pre-order.
Yes.
And then I'll have a gift for the summit. And then we'll go from there.
I love it. Thank you. Yes, yes. And
Yes.
so we have dropped the link in the chat,
Thank
KEISEAN. I
you.
wasn't sure, KEISEAN, if you had access to do that. You saw the private chat. So
I saw the private chat and
I
then it
guess
was
you
just
can
there.
see. I don't know what you're
Yeah.
Thank
looking at versus
you.
what I can see. Other things. So so it's there double. But yes. So thank you again. Make sure you guys are listening
My
to,
pleasure.
watching, tuning into a whole grown woman, not just
Yes.
a grown woman, a
A whole
whole,
grown woman. All of it.
all grown.
Yes.
So this has been awesome,
Yes.
awesome. Well, KEISEAN and I will be back next week. We won't have a guest next week, but the week after that, we're going to bring another guest from the summit to talk about that pelvic floor and that pen situation.
Yes.
She's gonna dig deep into that pen because it's deep.
Gotta
It's
love
way
it.
deeper way deeper than we think. So,
Hmm.
all right. Well, that is all. Any
Thank you,
last minute,
ladies.
KEISEAN?
Thank
Say
you.
bye.
Just thank you. Appreciate you. Thank you so much. Thank you
My
both.
pleasure.
This is so cool. I will be listening to your podcast.
Oh, thank
Congratulations on
you.
that. Yeah.
And
All
KEISEAN, your
righty.
podcast you got a new episode come out.
Yeah, I just came out of hiatus for 8 months and first episode came out yesterday. And so I'll be dropping episodes weekly.
Nice.
And yeah, it's everywhere that podcasts are podcasting. You can find it there, but it's working title. So yeah, but this is
Love it.
awesome. This is so cool. Thank you.
Awesome. All right, guys. You guys have a good night. Dr. Donna, you can stay right there. We're going to end the broadcast, but we'll be back.
Okay. Bye bye.
Bye.